Greetings, class. My name is Florence Pittman, and my presentation is about important facts to know about strokes in 2013. Within this presentation, I will talk about the definition, the types of stroke, the symptoms and causes, risk factors, diagnosis and treatments, complications that can happen, and the prevention. The definition of a stroke is a damage to brain that occurs when a blood vessel in the brain bursts or is blocked by a blood clot. Without blood and the oxygen it carries, part of the brain starts to die. The part of the body controlled by the damaged area of the brain can't work properly. Brain damage can start within minutes of a stroke, but quick treatment can help limit the increase the chance of a full recovery. This is a picture of a brain attack, i.e. stroke. The types of stroke are ischemic stroke, which is a blocked artery that can cut off blood to an area of the brain. 85% of strokes are this type. The second one is a hemorrhagic stroke, which a blood vessel can leak or burst. The blood spills into the brain tissue or surrounding the brain, causing swelling. This picture is showing what a blocked artery, which is a ischemic stroke, and a ruptured artery, which is a hemorrhagic stroke. If you look at the pictures, you can clearly see the differences between the two. Some informational statistics of stroke around the world. Actually, this graph shows that Denmark, France, Sweden, and the US within the time frame of 1990s to maybe 2010. What I want to point out in this graph that in the US, we have the most high number of stroke, especially in young adults. Um, it also shows that in 2005, the US Blacks are actually the highest number of stroke within the different countries on the graph. The Blacks have different risk factors that make them higher at risk for stroke, especially non modifiable factors, which are things we cannot change about ourselves. Example, your race, your ethnicity, your family history, and our genetics. Symptoms of a stroke. The best way to remember is in this acronym: B for balance. You have lost a balance or trouble walking. E for eyes. Trouble seeing out of one or both eyes. F for face. Weakness or drooping on one side of the face. A for arm. Weakness or numbness in the arm or leg. S for speech. Trouble speaking and responding to simple questions. And T for time. Time to call 911. This is a short video of the acronyms I just explained. You already know that staying in shape is one of the best ways to keep your brain too. We have other symptoms that they can experience, such as sudden confusion, trouble understanding and responding to simple commands, fainting, a seizure, or a severe headache. Causes of a stroke. This depends on what type of stroke experience. Blockage is an ischemic stroke. Active bleeding from blood vessels in our brain, a hemorrhagic stroke. Risk factors can be broken down into two categories. One, which is a non modifiable risk factor. Two, a modifiable risk factor. And non-modifiable are things we cannot change. Examples include age, your race, your gender, and family history of stroke. Modifiable are things we can change. Example, high blood pressure, high cholesterol, cigarette smoking, diabetes, obstructive sleep apnea, lack of exercise, obesity, alcohol usage, and some types of heart disease. Diagnosis. Strokes are diagnosed in these hospital procedures. Physical exams, blood tests, CT scan, MRI, a carotid ultrasound, cerebral angiogram, echocardiogram. Treatment also depends on the type of stroke experience. Ischemic stroke or blockage. Emergency IV meds are given to break up a clot, given within 4 to 5 hours from when symptoms started. Emergency procedures can be done to remove the clot. You also have carotid endarterectomy, angioplasty, and stents. Treatment for hemorrhagic stroke. Emergency treatment focused solely on controlling the and reducing the pressure and bleeding in the brain by excessive fluid. Emergency medicine to lower pressure and to the intracranial pressure. Sometimes surgery is necessary. And you have two procedures: endovascular embolism, surgical artery. Oh my goodness. SAMV, which is the removal of malformed connections of veins in the artery. Complications from stroke depends on what part of the brain was affected and how much damage caused by the stroke. You can experience loss of movement in limbs and loss of senses, speech and language, memory and thinking, perception, and emotions. Prevention. The key to prevention is to keep your modifiable risk factors under control. Manage health problems that raise your risk, which include arterial fibrillation, diabetes, high blood pressure, and high cholesterol. Avoid heavy alcohol use. Lose weight. Get plenty of exercise and stay active. Adapt more of a healthier diet, make healthier choices, and limit sugar and sodium intake. This is a short video that breaks down what are in my slides about stroke. You guys can watch it at your leisure. Remembering BFAST in the event of a stroke would give the person the proper treatment. And to be transparent, I had a stroke on October 11th this fall while we were here in class. I wasn't taught these warning signs when I had my first stroke in 2016 and ended up having a second one in 2023. So please take heed to your loved ones because it can be a matter of life or death. My research references, and thank you guys for listening.